The Indian diagnostic market has never had it so well. And if the trends are any indication, then we are going to have a catalytic growth in the industry segment. Affordable quality diagnostics for all, and especially in the semi urban and rural areas, will drive India's vision of Swasth Bharat and Shresth Bharat. Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Rupam Das with us. Rupam is the founder and CEO of Acculi Labs Private Limited. Acculi Labs brings down complex pathology tests to the pocket of clinicians and patients by replacing the complexity with the help of mathematics and algorithms. Let's try to find out how this healthcare startup is digitalizing the way we read, we go through our diagnostic reports, because we always know that early diagnosis is the key to healthy treatments, earlier treatments. That plays a very pivotal role. So hi and welcome to Medicircle, Rupam.
Thank you, Smitaji. Very good evening, and thank you so much for having me in your show and giving me this opportunity to talk to your viewers. Thank you for
pleasure is all ours, Rupam. So as you're the co-founder of Acculi Labs, so tell us more about your startup.
Acculi Labs is a very simple company. Our tagline is, we don't misguide patients. And that's a one-line statement. Now, what does that mean by not misguiding? We provide a completely live solution to people. At a time when healthcare talks about diseases, you talk about diagnosis, you talk about what is the illness, you talk about whether somebody has a hypertension or not, and then people treat it. So they give a medicine for a diagnosed condition. Our theology is that there is no such thing called disease. Life is all about anomalies, and life is all about living with those anomalies. So we diagnose what are the things that could be improved in the life. And that is the reason, by changing the perspective from identifying the disease to looking at a life as a whole through machine intelligence, through human intelligence, through observation, and a very detailed oriented system, what we do is we give back life to people. And just to give you an example of what we do, I'll share a short story. There's a small 7-year-old girl who never could stood up and who could never speak since the birth. She's an autistic child. Her parents were almost suffocated, and then they showed to all the people, different healthcare, different doctors. They were with us in 3 months, and now for the first time she spoke Ma after 7 years, and she's walking for almost 20 seconds. She's standing up in 20 seconds. So what we do is we people who are already frustrated, or people who have lost hope in something, the most complex cases, 10 years, 20 years of occurrence, they come to us for a respite, because most of them, they have given it up. They are all the time thinking about the disease. Everybody talks about the disease. So we diagnose what better could be done in their life, and we give back people's life. That's what we do.
That's great to know. So what is the prime unique value propositions that Acculi Labs have over other preventative healthcare startups? As one thing which I really liked about the theology, that we all the time are talking about diseases, but definitely we must think that diagnosis is also one part, and we need to live along with the anomalies and need to find a better solution among all that. So kindly comment on that.
Yeah, so first let me tell you that we are not really a preventive healthcare company. In fact, we are one of the toughest, which you call the serious healthcare companies out there in today's time. Our patient rating is more than 96%, which is a miracle in the healthcare. Almost 92% of the patients leave us to never come back, which means that, you know, if a police force is good, then you do not go there to write FIR, right? So we are not really into preventive healthcare. What we do is serious cases, which has been recurrent, something like piles, 10 years, 20 years, hypertension, allergy, all these complex cases we take and we serve them. We identify the root causes, we identify each and every dimensions of their life. Then we provide them treatment as well as the rehabilitation, which you call the rehabilitation back into their life. So our unique value proposition is people. Uh, Always it has been people. So other than the technologies that we have built, in fact, we are right now world number one in some of the keywords such as online mental health test, and then uh, female test. We provide a comprehensive set of tools to our women to take care of to test their own health, emotional health, menstruation health, etc. But barring that, what nobody can compete us with is our value system. Say, for example, we don't take cut from the pharmas. We don't take cut from references. We do not promote, which you call the excess medication. So our rate of medication per prescription is only 0.63, whereas the Indian standard is about 2.83. We reduce the medicine of people from their life to about 70%. So that's our USP. So we minimize the thought of the disease, medicines, cost, everything. So that's the difference.
That's great to know. And how many patients' lives you have touched so far?
Okay, so the numbers is very difficult to state in the medium. Now, we generally handle about 15 to 35 cases every month. They're very complex cases like cancer cases or cardiac cases. So our case is about 15 to 35 every month, and we work with the families and their extended families like that. So we are not we are into kind of a premium segment, and then there is a segment called public health, which is totally free for everybody, each and every citizen of the global citizens, where we have built several online tools. So you can go and check your own health, liver, kidney, anything without any blood test. And then there are set of instructions. So you follow the instruction. We don't charge money for that. And we serve about 500 patients freely every month through that. That so far that is the number, but we hope to provide services to about 10,000 daily patients to 2 years down the line.
That's great. And your startup has also received funds from Pyra Ventures and Startup Basket. So how much funds you have raised so far, and how has the funds been utilized?
Okay, so Acculi Lab has again, I mean, we have innovated in every domain. I would like to share with you that we have also innovated a financial instrument called PIO, Public Angel Investment Offer, through which we raised about 1.3 crore rupees from 140 investors. So starting from the tea delivery person, our tea wala, to our dhobi wala, to our housemate, everybody is an investor in the Acculi Labs.
Wow.
So that company is now being formed. So the objective is to promote sustainable businesses, ethical businesses, rather than just promoting the scalable businesses, because anything that quickly scales is just cancer and virus. Any normal growth, say for example, a dog's baby, it grows in 7 days, 10 days. A human baby takes about 3 years to at least start speaking, right? So we realize that the startup ecosystem is not going the way that it should go, and there is very minimum participation. So we created a platform for fundraising also, and not only that, we are right now raising fund for another 3 companies. So there are about 400 investors who have got associated. It's a RBI and MCA approved instrument. So we made a change over there also.
Oh, great. And tell us something about the revenues you generated in FY 2022, or what you're planning to close at this end of FY 2023.
Okay, so if I say that our target is to uh, recover irrecoverable cases by a factor of 1 case daily, would that be a good answer? Because we evaluate our success with the number of lives saved
Yes.
rather than number of money being made, because we make a lot of revenue from research and the other ways. For us, healthcare is kind of a religion. which is a social responsibility. So whatever revenue that comes from the businesses, obviously, if you measure the number of cases, you can estimate it. But if you can save 365 lives, let's say the children of that 7-year-old girl or a girl who was going through a cancer, ovary cancer at the age of 17. So if we save such lives, which is being given up by the conventional healthcare, and if we do that one case a daily, that's the ultimate target that we have. Beside serving this 10,000 people every day over a period of next 2 years time. So when we serve 10,000 people, obviously there will be some cross selling, there would be certain other things that would be coming in, but revenue would always be an add-on in Acculi Labs principle. We are not really because a lot of principles are based on not to misguide people, right? So for example, if a patient comes and we refer them a blood test, any other company or hospital would make money, but we don't make that money. That's why we do not suggest too many tests, we do not suggest too many medicines. So by keeping the revenue aside from, so when you do the duty, you get the revenue, which is an outcome. So our revenue would be probably I do not know how you evaluate a life say, but one life daily, that's target for next 2 years.
So it's a completely different ideology. I think many would be
Yeah,
aware of this. Apart from the numbers which we already always talk, the startup
yeah,
ecosystem, it is more than
yeah,
the human lives which any startup
yes.
or any entrepreneur is trying to save. Even one life a day is something great, which is incomparable with anything, any such revenue which you got. Well, moving on to
So
my
Smita ji, just to give you a perspective, when you look into a mother eyes, whose 7-year-old girl was crawling and she would go into puberty and will be crawling, and when you look into those father's eyes, then when you look into their father's eyes, when he sees his girl stand up, you know, that emotion cannot be described in the words. That emotion cannot be described in the, yes, business is for money, but business is for people also. So if you serve people, you serve the economy, then you anyways earn money. Now, a value of the system or business should be known to what impact you are creating in people's life. Can you be replaceable? Can that girl be made to stand up by anybody else? No. So we would want to do such miracles, of which they call one every day, and that should be a good number for the viewers to judge how much that should
very, very
be.
true. So, like presently, we are based out of Bangalore. So, what are your goals and especially the future expansion plans to move out to other cities of India?
We provide services to entire globe. 30% of our patients are from US.
Oh, wow.
About 15% of our patients are from UK. Because the kind of people we serve, they have been rejected by the global healthcare system. All right. So it's not only an Indian mother's problem. Autistic child is a problem of a lot of mothers, right? A girl who is going through extreme amount of mood swing, not having regular menstruation, and she is on OCPs. It's not just limited to India. It's a global problem. So you have to ask the question whether your priority is going to be $1 billion company, or you are going to stand for the women who are not able to get back their life and make at least thousands of such women become mother. So it's a global audience. Expansion, it will happen organically. It's almost like a movement. So good people will get connected, they will take this movement forward. And yes, 2027 we are planning for IPO. So I hope the numbers reach by then.
Congratulations for that whenever it comes. So, any advice for the young entrepreneurs? Because you definitely need to speak on this. See, we need to be definitely solving a problem. That's one thing which any startup entrepreneur should be thinking of. But beyond that, the impact what that particular startup is making on this particular ecosystem is as important as the problem. So kindly comment how the fellow entrepreneur should be thinking and what piece of advice you would like to give to them.
Smithaji, I'm too small to advise anybody, but I can share some wisdom from my life. Is that life is all about people. You know, if you have people, your life is sorted. If you have somebody to love you, if you have somebody whom you can respect, if you have somebody to talk to, your life is sorted. Life is not all about numbers, Excel sheets, AI, and ML. It was like this 18 million years ago, and it will be like this even 18 million years after, irrespective of what the industry says. If a person really goes deep down and does everything of his own to start with, don't think about the scalability and the other things, fundraising. India is a great country where people stand by you. So once you get back into the ground and solve somebody's problem, it's not the product which matters, it's your human attitude, how much humanity and humility and human values you can adapt to. Because there'll be a lot of people who will stand by you. You have to serve for a lot of people. If you can just think that startup, any business, or any responsibility is a responsibility towards people, then I can assure you that there is no such thing called failure. There is no such thing called losses. People will not need a lot of money, and whatever money they need, of course, our bio investors are always there for the founders who are serving people.
Great, great. So thank you so much, Rupam, for joining us today at this healthcare startup series. It was really a pleasure talking to you, because
Thank
we
you so
always talk about numbers and investments and funds,
much.
but today we talk about one very important factor which many of us might have forgotten, that it's the humility, it's the human touch with
Yeah,
which
it's
all
about
that.
emotions, Mitaji. You uh, uh, see, you can lie the entire day very much. You can do Excel sheets, but when you go 10 p.m. in the night, you are with the pillow. You cannot lie to yourself. You can pretty much say in the entire day that I'm happy, I'm very independent. But that pillow is very punishing. The pillow is going to ask you, what is your relevance? And then when you peacefully tell the pillow that I have done this and I have this many people in life, that pillow gives you the peaceful sleep. So with more money you can buy more food, but the more food you eat, you will have liver disease. But with more values you'll get better sleep, and sleep you cannot buy. No medicine can give you the sleep. So that's the and thank you so much. It was pleasure. Even before the call, what we talked, it was very pleasure, and I wish you all the best. Medcircle is doing quite good, and I would love to thank you for this opportunity.
Thank you so much.
Thank you so much.